financial income, because if they say something, they are totally afraid that they might not be brought back the following year. So all those different variables are contributing to the spread, in my opinion.
Thank you, Armando. And I know you had to leave, so thank you so much for joining us. Sorry that we couldn't get to you till this time.
No, I appreciate it.
All right.
Like I said, I put my email and my
Yes.
media contact on the chat. I apologize.
Mm-hmm.
I just have another meeting that I couldn't get out of.
Yeah.
So,
and Armando is pretty easy to reach, so write to him and he'll respond. Thank you so much.
Thank you all.
Okay, so I actually want to go to Luis Olmedo, who was answering in the chat regarding the testing, because he has something to say about it. Luis, can you say what you were putting here in the chat regarding testing?
Yeah, so I think it's the way I like to answer this is, I definitely respect the space of the medical staff, the healthcare staff, the county, and all the experts, and that's what we rely on for our messaging. But at the same time, we have to understand the realities and some of these political realities that when this initial pandemic started hitting this country, the state, and this region, we heard a lot of promising messages that PPE is coming, tests are coming. And I think that a lot of these elected officials got ahead of themselves, and we waited and we waited and we waited, and it didn't get here for a very long time in reference, in relation to the urgency that we needed it. So we did have some like private doctors, and here locally we have Dr. Bovo Medical. And I remember many conversations with him, and he says, you know what? Nobody's telling me where to go. Nobody's giving me a seat at the table. I'm going to do this. I'm going to save lives, regardless of what anybody else is saying or not saying. And so we saw him go out there outside of protocol and went out to save lives. That's what he wanted to do. And then we didn't see testing. He started doing drive-through testing when we didn't really see official tests happening until quite a bit later. Again, that's because you're seeing what, the importance of bringing in private doctors, the nonprofits. A lot of these, we don't have to go through these bureaucratic hurdles, these red tape, in order to be able to go out there. They're ready to go out there. They just need more resources and the ability to put this resource out there at a much faster rate than government. We forget that a lot of times, even though there's an emergency, it doesn't mean that we wipe the protocols off the books. It means that they are moving at a much faster pace, but they still have to go through the red tape and through the protocols. And I think that's what you also heard what the governor said several times, is that we're getting this PPE, but it's stuck here, it's stuck there, it's in contract, and these things are failing. And that's the reality of the bureaucracy. So.
Mm-hmm. Thank you, Luis. Thank you. I think we're going to stay on a few more minutes. We have a few questions on in the chat. And Fran Blanquet, you have a really good question here.
Yeah, so my question, and I guess it could be answered by a number of you guys, but what is being done to deal with communication issues for migrant workers that only speak an indigenous language and are not fluent in English or Spanish? How do you help them communicate to them that they need, when they need medical attention and other services?
Michelle, do you have anything to say here regarding indigenous languages? Can you unmute Michelle Garcia? Thank you.
I'm sorry, I didn't hear the question.
The question has to do with migrant workers who only speak an indigenous language. Is there any capacity there?
Well, it's unfortunate. We don't have all the knowledge that we can at this point to help them, and it is a serious issue. I wish I could say that I knew of another solution, but right now it's pretty bad.
Yeah.
In regards to those patients that I see that are Hispanic, and that speak Spanish, that's obviously I can help them. However, the message isn't getting across. That's just how it is. So I'm sorry, that's all I can say about that.
Thank you, Michelle. Thank you so much. Do you have anything to add, Luis Flores, regarding the indigenous population?
No, that I don't know much about that, but I'm not optimistic. I think it's been hard to reach Spanish-speaking folks, particularly precarious workers, which I imagine doesn't bode well for reaching folks that, yeah, where the language is not the dominant language like Spanish is.
Mm-hmm, mm-hmm. So we're going to go to until just 4 more minutes. What can the press and the public do to help? Any of you, please tell us what we can do to help with the situation in Imperial County. Anyone?
Yeah, so I think one thing I'll highlight is, and I know Professor Flores mentioned this as well, but to sort of to really push for data, and as opposed to sort of kind of anecdotal. I think we need to rely on a lot of strong anecdotal stories, but sometimes the focus turns to private behavior. To, oh, I saw a party happening, therefore sort of transmission is happening at parties. We don't actually know that, and so I think pushing for and looking for those that data that would actually like tell us where it's happening, particularly in workplaces, I think is really important.
Thank you so much. We have, I don't know, okay. Okay.
I thought I might chime in for a second.
Yes, please go ahead, Professor.
In regards to what's important in Imperial and beyond, there's an emergency standard that advocates are calling for, Cal OSHA, Occupational Safety and Health in the state of California. The Agency for Health and Safety in California, to adopt an emergency standard that's COVID related. And so that would go a long way in addressing the fact that COVID is spreading in the workplace, even when we shut everything down. So I think that's something, I mean, I could circulate that information for anybody that's interested as well.
Okay. What does that mean, Dr. Flores? Emergency standard, how would it change?
He's muted.
Can you unmute Ed Flores, please? Please unmute. Hi, guys. Okay.
So there's many things in the emergency standard that advocates are asking for the board to approve next week on Thursday. Some of these items include collecting information that's industry relevant to COVID positive tests. Another important item is having business mandating that businesses have one worker in each work site that's trained on COVID related safety and reporting, and that they work with a worker or labor organization in order to have better oversight of COVID health and safety standards in the workplace.
Thank you so much. Before I go to Sandy, I want to invite Blanca Morales, who's the Executive Director of the Calexico Wellness Center. She has something very important to talk about here, to say briefly. Blanca, can you talk about this lack of technology? People don't have phones to do the telemedicine?
Yep.
Yeah, please go ahead. Blanca, are you there? Blanca Morales, can you unmute her?
I think she's not able to connect.
She's not connected to the audio.
She's not connected to the audio.
Okay. Well, she was mentioning that the people there do not have smartphones, and it's
can I say something about that? I'm sorry.
Yeah.
I think she's trying to say is the fact that there are patients that I cannot see because they actually do not have access to smartphones. So getting them that technology, supporting them with supplies, with food, things like that would help us, and thus create, a better response. So yeah, I think that's just what she's trying to say.
Okay. Many details. Thank you so much. Sandy, go ahead to close this briefing.
I just wanted to close us off by saying it is media attention that drew us to Imperial County. We probably would not have done this briefing had we not seen an excellent story in the Chronicle. And what led to the story was the activism by some of the people on this panel and their organizations. In other words, this isn't just about victims. This is about an impact the pandemic is having to mobilize people when the government and the public health protocols are no longer relevant to their survival. Finally, in terms of the data, I think foundationally for our coverage, the policy brief that Dr. Flores and Ana Padilla have put together for us provide very important data that support some of the anecdotal, the very eloquent descriptions people have made of the situation in Imperial County as a microcosm of the factors that are leading to surges in areas we don't often pay attention to, and that there's so many lessons we can learn from reporting on Imperial County that are relevant to a much wider sector of California and of the United States. So thank you, Pilar, for coordinating today's briefing, and thank you on behalf of all of us journalists to the speakers. We've really just scraped the surface of this very big story. You'll be getting everyone's name and contact information and the video, and we hope you all will follow up on what we've just started as, I hope, more in-depth inquiry. Thank you.
Thank you, everyone. Take care of yourselves.